Hi, everyone. I'm just going to repeat it for the sense of the recording. Welcome to another Michael Davis lecture. Today is featuring the book by author Dr. Luke Schaefer. As questions arise, as Dr. Schaefer and Dr. Rubin Miller are discussing his new book, please post questions in the Q&A pane and the chat function within Zoom. We will try to answer as many of those as possible towards the end of the presentation today. Again, this is a recorded webinar and will be posted on the Chaz website and on the Chaz YouTube channel. And with that, now I'm definitely passing the mic to Dr. Rubin Miller.
Hi, everybody. It's just a great pleasure to welcome my dear brother and friend Luke Schaefer back to campus. You know, I have deep bonds of affection for Luke, and Luke knows that. And I was looking forward to being able to spend some time with you, brother, before we begin. So let me just say something about Luke. You know, I'm sure many people on this call, this webinar, know Luke, but for those who don't, he's the Herman and Amelia Cohn Professor of Social Justice at the Ford School of Public Policy, and he was also for years a professor of social work at the University of Michigan. He's the inaugural director of Poverty Solutions. This is an interdisciplinary presidential initiative that partners with communities and policymakers to find new ways to prevent and alleviate poverty. Luke has won a bunch of awards, you know, early achievement awards from SWR, Carnegie, a fellowship. He wrote a smashing book that along with co-author Kathy Eden, that won a million more awards. It's just done fantastically well. It's sold a bunch. That was, of course, $2 a day, which really spotlight, shone a light on extreme poverty in the United States, applying you know, what is typically a metric that we use when we think about community development in so-called developing countries, and using that framework to help us understand the many ways that things like welfare reform have failed, the production of 4 million people who are living under $2 a day. You know, just a striking and powerful book. And we have a new book, The Injustice of Place, where a truly mixed methods book, you know, a kind of work of certainly sensitive analysis of administrative data, interview-based data, observational data, and really a deep historical analysis of what's happening in the most disadvantaged places in our country, with really surprising findings for how we think about poverty. Again, Luke is changing. Luke and his colleagues, in this case, also writing with Kathy Eden again, but also Tim Nelson. Luke is helping us reimagine how we think about poverty yet again. This says nothing about the dozens and dozens and dozens and dozens of articles that he's published, the many grants that he's won. You know, Luke, you're an incredible brother, and I'm just so glad. I'm so glad that you're here with us. You know, and so let's please. Oh, just go.
It's
okay.
So great to be back at the Crown School, SSA. I don't know what to call it as an alum. So I'm going Crown. I'm going with the new, and there's just no one I'd rather be talking about this book with than you. And you know, some people say your blurb is maybe the best part of the book here on the back cover, so people can check that out when they buy it.
Luke, man, so glad to have you back at SSA. It'll be SSA forever. But anyway, but I want to start off by talking about the birth of the book. You know, I remember us having conversations, you know, some years ago about dignity. So just allow us to go like a slightly different path into the book, though. You know, and you were thinking years ago, you were thinking a lot about dignity, and you were thinking about dignity because of, just your work on $2 a day. I remember most specifically about going to, blood donation centers, plasma centers, this kind of thing. Like you thinking about this question. And so can we talk about, on the idea of dignity for a hot second? And I know that's not a central framework chosen in the book, but I feel like this is a part of the on-ramp. Can we talk about dignity for a second, and then let's talk about kind of the on-ramp into this new project.
Yeah, that's a great question. And one I haven't gotten in talking about the book, because you know more about the genesis than other folks. So you're right, out of $2 a day, that was a book about the need for money. So we were following families who might have food assistance, might have access to nonprofit charitable services. Some have a housing subsidy, although like in Chicago, when we were doing our field work, the wait list for a housing subsidy was 85,000 families long, and it was closed, so you couldn't even be 85,001. But what there really wasn't anything of was cash for families who might be working in a low-wage job, and then they fall, into a spell, whether it's because their job is unstable. You've got stories like Jennifer Hernandez, who's cleaning foreclosed homes throughout Chicago. Ray McCormick, with a family life that's unstable, and she can't get to work, and her boss says, if you can't get in, don't bother coming in again. So we were thinking about the importance of cash and what it means in 21st century America to go without any money. But some people sort of thought, well, maybe Eden and Schaefer are arguing that we should go back to the old welfare system that we had. And in fact, we also really came to understand how incredibly stigmatized that program was, and how much of what we do to make families sort of get aid, we think maybe impacts them directly. And so Kathy had done some work on the EITC, so that's an earning subsidies, but it also comes through the tax code. So you're doing something all Americans do, you're filing your taxes. And so families really thought about that money differently. So that sort of led us on, I think, two trajectories. One was around like, how can we provide cash aid to families in a dignified way? And another is to just really understand that like we impact, like poverty is not just the lack of money, it's a relationship between people. And it really needs to be understood at a community level, because we can't just problematize the person. So with the cash argument, that's where we got to child allowances and child benefits. It's like, oh, can we find some policy that provides a stable cash floor for families with kids? Innovative, never been thought of. And like you go and look around the world, and like dozens and dozens of countries have done this sort of thing already. In every country that does it sees child poverty plummet. They see food hardship plummet. They see families and kids do better on many different outcomes. And so we proposed converting our child tax credit to something that would be more like a child allowance, $250 per month, $300 per little kid. And we wrote that paper with a whole bunch of collaborators, Jane Waldfogel, Tim Smeating, Greg Duncan, I'm going to forget many of them, Chris Weimer, Sophie Collier. And when we did it, people thought, oh, this is pie in the sky. It's never going to happen in the country. But it turns out like that paper, helped shape something called the American Family Act, which had a couple of sponsors in the Senate, and then had a lot more sponsors. And then when President Biden was looking around to do something for families with kids in COVID, they put it into the American Rescue Plan. And guess what? We had a child allowance in the United States, and child poverty plummeted to an all-time low, and food hardship plummeted, and evictions stayed way below their pre-pandemic level. And so, it's so interesting, Rubin, because it's in many ways, we're doing the same thing we were doing under welfare. We're providing unrestricted money to very poor families, but we're also giving it to middle-class families too. And the logic is completely different. It starts with the logic that raising kids is expensive, and society has a reason to come alongside parents in that work. And so it was a lot more popular and it worked, and it wasn't extended. And that was the worst day of my professional career. But it's in the public imagination now. It's something that we can do for families with kids.
So the reason I wanted to hear that story, and I didn't know the direct connection between your thoughts about dignity and the child allowance. So so that's fascinating, and it's going to come up over drinks later, right? but two, the second thing that's really interesting is it strikes me that like this work, like one of the reasons why we almost ended child poverty in America and then overnight didn't is because we don't understand poverty. We pulled back our the hand that we offered, because we don't fully understand poverty. We didn't understand poverty when we did welfare reform. We really don't understand poverty now.
Totally.
And this book is doing two things. So on the one hand, it's sort of reframing what poverty is and how it happens, which we'll roll into. But the thing I wanted to say to you was that it's holding constant the idea that these are human beings, right? Like, so it's like what the book proves is that poverty is not a moral deficiency. It's not on the part of the poor, right? Like on the part of the poor,
right.
Yeah. But these other things that are involved in the production, like poverty is produced by actors, by people who do things. And this is one of the benefits of the book. You all not only name processes, but you name names, you name actors, you name political figures. And so anyway, now let's talk about this book. So how do you come with this idea of, knowing that we don't understand how poverty works? How do you come to this book and why its focus, which happens to be a geographic focus, happens to be a community-based focus, but also has to be a focus on things like relationships, and it's relationships to politics, relationships to what happens at the community level outcomes, the relationships between families. Like how do we get to this place?
So very early on, after $2 a Day was published, I sort of had this idea that I'd like to really go to some of the nation's poorest places. And I think it was, just for both Kathy and I, we were starting to read more of the work that was coming out. Like, we had the great studies like the Truly Disadvantaged that sort of made the case that being poor in a poor community is worse. Although like the relational piece, he's still sort of saying like this is the problem of the people in this community, and then there's the large scale forces in structurally racist policies, but there's less sort of back and forth of people. And then we were watching some of Ross Chetty and Nathaniel Hindren's research that was coming out, which is all on social mobility. If you grow up poor, are you likely to be poor as an adult or rise to the middle class? And, one of the striking things about that work was how different it is depending on where you were. So in some counties and some cities in the United States, if you grow up poor, you're just as likely to rise to the middle class. Sort of that vision of the American dream is alive and well. In other places, if you grow up poor, you're probably going to be poor as an adult. And so there's very low rates of social mobility. When you look at things like health, like, huge differences in life expectancy from county to county. You can expect to live a decade shorter if you grow up in a very poor community, and like fairly small levels of geography. And then obviously very different rates of poverty. So we wanted to try to understand that, right? What could be the community level factors? What could be the mechanisms that would really explain why we have such big differences across space in the United States? And really, I think we're pushing this sort of field of, just as you say, understanding poverty as relational, that it's about what's happening in communities. So it's not just a challenge facing people who are in poverty, but a challenge that's brought about by everyone in the community, and then, you know, in the broader society. And so, you know, I think Matt Desmond's new book does some of this in the, you know, a few months ago. There's some other scholars been hitting at that. And in this book, I think we try to think of our contribution as really getting at like the nuts and bolts, as you say, like how has this been perpetuated in very poor places, and like what is the legacy, and in you know, maybe I'll just put up you know, 2 charts real quick that could walk people through how I'm thinking about this. Sid showed me how to do this. So we use, let's see, everybody can just see the big map. Is that right, Rubin? Are you seeing the map, or are you seeing mine? Okay, awesome.
We're seeing the western half of the United States.
Just the western. I see the whole thing. This is
No, it's the way my screen is set. Apologies.
okay.
Oh, okay.
Whole United
All right,
States.
good.
Yeah.
All right. So the western half actually looks pretty good, except so this is based on our index of deep disadvantage. We're using poverty, but also life expectancy and infant health. We're using the Chetty-Hindren social mobility metrics, and then throwing it into a principal component analysis that's like machine learning that can rank all of these places on this continuum. And you can see that there are these big clusters. We've got both counties and cities. So the little dots are cities. And you can see these big clusters of deep disadvantage in Central Appalachia, in the Cotton Belt, and the Tobacco Belt, and then South Texas. And one thing that was really interesting for us is how few cities appear in like the most disadvantaged in our sample. So when you're looking at like that bottom 100, it's almost all rural communities in these regions. And then, you know, if you look out west, you see, you know, far fewer in the deeply disadvantaged category, except for these pockets, which are native nations, which are also, you know, their own long story of history. But very early on, we started to sort of look at the history, like, and this is getting back to the point, Rubin, that you were starting us on, and like thinking about how can it be someone's fault that they're in poverty? How can it be an individual level choice if this map has sort of looked pretty similar for generations? And so one of our team members, if I can get it to move forward. I think that just popped it to the next slide, right? So one of our team members, they brought us this. This is a map on your right of enslavement in 1860, and our map of disadvantaged on the other side. And so from these maps, you can see like not just, you know, some sort of correlation, but like a very clear similarities in the gradation of our deep disadvantage in like 2016 through 2019 and enslavement in 1860. So, you know, especially if we want to say like this is somebody's fault, it's hard to reconcile that with the fact that like we can go back and, you know, we can talk about any sort of like causal mechanism, but we can understand what's going on in a community today with like a history of exploitation that's 150 years old.
Let's oh, the slides are showing your notes. We just got a note.
Nothing bad in the notes, so.
Okay, great. You know, like I hate Rubin secretly. So can we I want to back up just for a hot second. I mean, so I mean, you said this already, but I do want to underscore it. You know, you decide to focus on places. Like geography is the kind of linchpin, you know, and so can we talk a bit about why geography matters so, and then we'll jump into the history in a second.
Yeah, I mean, the empirical like answer to that is at the start is that like like people's outcomes are determined by their geography. So, you can see, somebody who grows up poor in one community is just as likely as anyone else to rise to the middle class. Somebody who grows up poor in another community is most likely to end up poor when they grow up. So just wanting to understand those differences. So that was really the start. And then you can think of it as like, what are all the factors that could explain that? Some of them are like local economies, right? What jobs and opportunities are available? Healthcare systems, school systems, the efficacy of government. These are all some of the potential things that could be impacting why people, one community has much better outcomes than another. And that's where we don't understand that on a national level. And that's part of what we were really seeking to understand is like, what can account for these differences? And I think, where history really comes in is understanding that like, none of this appears out of thin air. It's not just happenstance that different communities have, very different outcomes. And so the book is really trying to offer a way into understanding what may be some of the mechanisms that really help us understand why this sort of deep disadvantage is perpetuated over decades and even centuries.
Can we talk about some of these mechanisms for a hot minute? I mean, so I have to tell you, in reading the book, one of the things that I was most surprised by was that every place, I mean, there's a line in the early parts of the book, every place is the first for something. So you look at these 200 places, and then collectively you all visit about 75% of them. So you do your analysis of deep disadvantage, which includes the health measures, social mobility, as you mentioned, also income, but income is not enough. And these are largely rural places, as you mentioned, and then you go, and then you see for yourself the here and now, but then you begin to unearth the history of it. And each place is a hub of innovation. Can we talk about innovation for a hot second?
Yeah, I'm glad to talk about that because I found that really interesting, right? So as you mentioned, we spend a lot of time traveling, and then we have these 4 field sites. So we're in Clay County, Kentucky, LaFleur County, Mississippi. We're in Marion County, South Carolina, and then Zavala County in South Texas. And so these are sort of each places that are in the clusters of our regions. Some of them have like really, really high poverty rates and do a little bit better on life expectancy. Others have not bad poverty rates, but like really bad rates of social mobility and poor health. So the site selection really takes advantage of this this index, like sort of the multi-factor parts of this index. But as we were sending students down there, so we had some wonderful graduate students from both University of Michigan and Princeton who spend a couple weeks in each of the field sites, and we as the investigators are going down over and over again. And there had been some on like the sort of the histories of each place, right? There's some research on each of the places, but very quickly, sort of one of the interesting themes was this sort of innovation, this sort of industrial prowess, right? Where every single one is the capital of something. So in South Texas, Crystal City, this town of a couple thousand, and Zavala County, it's the spinach capital of the world. And there's a couple of different statues of Popeye in honor of that. And we all have selfies with a statue of Popeye that commemorates that. And like the town, one of the great annual events is like the Spinach Festival, and there are women and girls who are crowned the Spinach Queen and the Spinach Princesses. in Greenwood, Mississippi, it's cotton, right? It's like the cotton capital of the world, I think. And there's a Cotton Bowl. That's like one of the big events in the course of the year. Over in Marion County, bright leaf tobacco is sort of basically the strain of tobacco that allows us to start making cigarettes and sort of basically popularizes smoking, because you can make these relatively cheap, cigarettes that can be consumed by lots of people. That all happens right there. And then in Central Appalachia, first it's timber, it's salt, and then it's coal. So you see these like industries, and there is this innovation, right? These like very American stories of innovation. You've got Eli Whitney is actually heading down to the South to become a teacher. And he gets sidetracked because he gets like just obsessed with like how do I make it easier to like strip the cotton from the plant, and ends up going to Nathaniel Greene's widow's plantation and like figuring that out. And there are these stories of like figuring out that you can plant spinach and onions down in South Texas after they figured out irrigation from springs underneath, and like the discovery of coal. So there's like these American stories of innovation, and these are industries that really they don't just drive sort of the local economies, but they all drive the national economy, and in some cases the international economy. Like cotton from the South is being shipped over to the United Kingdom, and is the main driver of textiles, right? As trade starts to proliferate all across the earth. So, you've got these stories of innovation, but there is this other side to those stories too, that in each case, these are industries that require a large, low-wage labor force, and the industries are controlled by a small elite that end up controlling not just sort of the industry, which dominates the place, but like sort of all aspects of economic and social life in order to sort of perpetuate the order that is required to keep it going.
I mean, this is just a really